Hi, today is Wednesday, November 9th. It's been 5 weeks since my surgery. My surgery was on October 4th, so it's been about 35 days after the surgery. So I want to make an update video to kind of track my progress and kind of give an update about what's been happening. I haven't made a last one. My last one was 9 days after the surgery. I haven't made one since then. Mainly just because nothing big's been changing. It's just kind of been healing. Swelling's gone down, as you can see, in my cheeks, and a little bit up here. It's kind of hard to tell. And then things have healed on the inside. All the stitches kind of dissolve away, and everything gets more less tender. Kind of just heals up as you'd expect. But physically, nothing really changes from, at least for me, since day 9 until now. Like I said in my last video, from the neck down I feel 100%. I still can't work out or anything like that, but I feel fine there. And then it's just kind of the swelling's gone down, so I'm getting more feeling back and things like that, so that feels a little better. But really there was nothing to update about, so I didn't really make an update video. You can see in my last video I had a splint in, which the name is kind of deceiving. It's basically just like a mouthpiece that's molded to your teeth so that your bite can close easier. And that was in for 5 weeks, so I got that out today, which just felt great just because you have this big mouthpiece, mouth guard mouthpiece type thing in your mouth, and I finally got it out, so it feels so good now. I can talk a million times better. I can open my mouth more. I'll give you a close-up on my mouth. So you can see I can open my mouth a lot more. Obviously my front teeth are, my upper jaw's in front of my lower jaw now. That's what I got done, correct the underbite. So that looks really good. Doctor says everything's looking really good. Everything's lining up well. In terms of the splint, I know I watched a ton of videos before I got my surgery, and I didn't hear anyone mention anything about a plastic splint. So I know most surgeons, I believe, use a splint during surgery at the very least, just to line everything up and make sure all the teeth are fitting together the way they want them to. And then some of them will leave the splint in after surgery just to keep that bite the way that they want it, and some will take it out. So I'll just ask your surgeon what they plan on doing in that regard. I didn't even know until the day of surgery, so I would ask your surgeon what they plan to do with the splint. Just so you know, it's not really it's just really inconvenient. It's kind of annoying. It gets in the way of eating and drinking and talking and things like that. But it wasn't that big of a deal. But yeah, now I can stick my tongue out. I can lick my lips, things like that. So that feels kind of good. As you can hear, I'm talking a million times better. The rubber bands I have now are a lot more elastic, so I can open my mouth more. I have more freedom there. I'm getting a little sore only on this side up here, just because I'm moving my mouth a lot more, my jaw. So I think that's as expected. I see my skin's kind of irritated. Obviously when you're swollen, you're stretched out a lot. So I don't know if whatever, but it's just my skin's kind of broken out a little bit, but again, not a big deal. That's going to go away. I don't know really what else to say in terms of pain. Even in the last video, I wasn't in any pain, just a little uncomfortable. Now I pretty much feel normal. Cheeks, I feeling in everything. I feel everything up here, a little numb up in here. Swelling still a little bit, I can tell. Down here, my neck kind of a little bit tender, but not bad at all. Everything up here feels fine inside. My upper lip feels pretty much normal. My lower lip's a little numb still, but feels a lot better than it did. The gum line is a little bit tender up here still, but again, that just takes time. That'll go away. Um, feel free to ask any questions you want. Don't be bashful. I want to help anyone that wants help, or and no question is dumb. Anything you want to know or anything at all, please, ask. I'm more than willing to help, or attempt to help anyone or answer any question about my experience that you might want to ask. If you're gearing up for this, you're getting ready to do it. I would just stay positive mentally. Like I said in my last video, the first 5 days are really the worst. And, again, I like to talk about things I've heard other people talk about. So I just want to be realistic in what to expect. I mean, you're not going to feel very good. Your body's going to feel kind of sick just because you don't have as much nutrients in them. You're not supposed to eat for like 12 hours before surgery, and then after surgery, you just don't feel that great from all the medicine and everything. So it's kind of hard to get food in. Food, you don't really eat any food, but just like any type of liquids or anything. Like I said, I drink Gatorade and Ensure. The Ensure shakes are really good. They have a lot of calories and protein in them. Milkshakes is great. I had a ton of milkshakes, high calories there. The milk, chocolate milk, I had a lot of that. Get some protein there. But again, just to expect, you're not going to feel that great. Everything's going to be really, it's going to feel like you got hit in the face. Like everything's really numb and swollen, and you just kind of, if you're getting upper and lower, your nose is going to be stuffy. It might be a little bit, some blood might still be coming, in the inside, which is nothing to worry about. It's just so you're not freaking out if that happens. But I'd say the biggest thing is just to be positive and know it's going to get better, and it's going to change your life. I can already see what it's done for me. Even though I can't really smile the way I normally could, just because it's still kind of swollen and it's still kind of tight up in here. But just stay positive. Take it one day at a time. Every day it goes by, it's going to get better. And once you get through day 5, you're going to feel so much better. So just be prepared for what to expect, and just keep a positive attitude. You might feel a little depressed. I was kind of down and you know just irritated, and was in a bad mood for the first 3 or 4 days, and just all that kind of stuff. But that's just know that so many people have gone through it, and you can go through it too. You'll be fine. You just keep a positive attitude. And if you have any questions at all, please feel free to let me know. I might make another video in a few days if I think of something I might have left out. Otherwise, I'll probably just do it another couple weeks just to see some more progress. It's probably going to be really subtle at this point, just because it's, I'm kind of on the tail end of everything. I'm seeing an orthodontist next week, so the next step is I'm going to, I have braces on the inside of my teeth like I showed in my first video. And probably like 6 more months of braces to move everything around. My bite still feels a little weird because all my teeth aren't touching right now, but that's going to get changed from the orthodontics. So once all the teeth start moving, everything's going to get fit right into place. So that's the next step. But other than that, I don't really have any other things to say. Let me know if you have any questions. Please feel free. I want to help anybody. So I'll see you when I see you.